Good day, everyone. I am Norshella E. Balada, a student nurse of NSG103 campus, and I am here to provide or deliver an information about health education, talking about kidney failure prevention. So first, let's talk about kidney failure. So what is kidney failure? Kidney failure is the condition in which the kidney is no longer able to filter blood to remove waste, toxins, and excess fluids from the body. So this can lead to dangerous levels of fluids and electrolytes that can cause complications and may require, if severe, may require dialysis and even transplantation. So there are two types of kidney failure. First is the acute kidney injury, which is the sudden decrease in kidney functions, and it is often reversible with early treatment. While this CKD, or the chronic kidney disease, is the gradual loss of kidney functions, often possibly leading to end-of-stage renal disease, or the ESRD. So ESRD is the last stage or the fifth stage of chronic kidney disease. So it develops when the treatment for CKD is delayed or not treated at all. So what happens when kidney fails? So first, waste builds up in our bloodstream, or what we call the uremia. The next, our blood pressure increases, and then the fluid overload may occur, like it can cause swelling over your hands and feet, and electrolyte imbalances, like it can cause hyperkalemia or the high potassium level. So this is what happens when you have hyperkalemia. And then the patient may require an expensive dialysis or even kidney transplant. So that's kidney failure. So what are the evidence-based practices that supports kidney failure prevention? So first, lifestyle modifications like diet, exercise, and smoking cessation. Of course, healthy diet. You need to reduce your sodium intake, you need to reduce taking saturated fats and processed foods, and you may adopt this DASH or the kidney-friendly diet. The next, exercise. You may have a 150-minute per week of moderate intensity physical activity that can help maintain blood pressure and even weight. And then next, smoking cessation. You need to stop smoking because it damages blood vessels and may accelerate the CKD. So again, CKD, if not treated, it can lead to end-stage renal failure or disease, which is more fatal and dangerous. So next, management of underlying conditions, diabetes and hypertension. So diabetes control, you use insulin or oral hypoglycemics and monitor your blood glucose to monitor your diabetes. And then hypertension management, maintain BP at least less than 130/80 using medications and lifestyle changes. So that can. And then next, medications and treatment. So like ACE inhibitors, it helps protect our kidney function. It is a drug that can protect our kidney function in people specifically with hypertension or diabetes. So that's what ACE inhibitors do in our blood vessels. And then next, avoid nephrotoxic drugs, or the drugs that can destroy our kidneys, like NSAIDs and antibiotics, certain antibiotics, unless monitored by the physician. And then statins. So these drugs is used for dyslipidemia, or it is used to reduce cardiovascular risks which are linked to chronic kidney disease. So next, what are the significance of preventing kidney failure? So first, of course, because of its impact on quality of life. So when kidney failure affects physical, emotional, and social well-being. When kidney fails, a person may experience fatigue, dietary restrictions, dialysis sessions, and even hospitalizations, and introduces patients or persons' independence and lifestyle quality. And then because it can cause economic economic burden on the healthcare systems. So treatments such as dialysis and transplantation are very expensive and ongoing. Role of health education prevention. So health education increases awareness and encourages healthy behaviors and empowers patients to manage risk factors effectively. What are the importance of regular checkups and screenings? Routine lab tests like serum creatinine, urine albumin, and GFR, it can help detect kidney damage earlier, particularly in people with diabetes, hypertension, or with a family history of CKD. The next, balanced diet. It's vegetable, whole grains, and low sodium intake. And then physical activity to enhance cardiovascular and renal health. And then hydration, so staying hydrated, adequately hydrated supports kidney function. Next, what is the importance of health education in preventing kidney failure? Educational interventions delivered through clinics, through schools, or even media campaigns helps populations understand kidney risk factors and adopt preventive strategies. So there are certain strategies for effective health education, like using cultural appropriate materials. You can tailor content to local beliefs and languages and literacy levels to make them understand the importance of preventing kidney failure. And then next, community engagement. Leverage peer education, barangay health workers, or even local clinics. And then the use of multimedia. You can use videos, infographics, and apps to enhance how you convey information effectively. And then interdisciplinary collaboration. So like nurses, dietitians, and educators may collaborate to reinforce behavioral changes in reinforcing kidney failure prevention. And then next, empowerment and motivation. So you can teach patients to self-monitor blood pressure, self-monitor glucose intake, and lifestyle factors. So that's all. Thank you for